Stem cell therapy is a form of regenerative medicine that uses stem cells to repair and replace damaged tissue. The potential of stem cell therapy is immense, addressing conditions ranging from joint pain to heart disease and so much more. So here is a stem cell. We have a stem cell, which is the big kahuna, I guess you could say. Let's see if I can get this to work. So you have the stem cell, and it can differentiate into blood cells, or it can differentiate into mesenchymal cells. And from there, it differentiates into skin, nerves, bone, muscle, eyes, ears, nose, any type of cell that we need. And it's vital for our bodies to have this mechanism so that we can repair ourselves. Without this mechanism, our bodies wouldn't repair. As we get older, our bodies have the ability, or have a decreased ability to repair itself. When we're born, we have 1 to 10,000 cells, or stem cells. You can imagine we have trillions of cells in our body. 1 to every 10,000 is a stem cell, meaning that when we are little, we get cut, and it heals in 3 days. Babies grow up, they don't have a scar. They have no evidence of that because their ability to regenerate and heal themselves, it was greater. But as we get older, into our 80s, it's suspected that we have 1 in 2 million and sometimes 5 million, depending on how you are when you're younger. When you're born, you have a set amount of stem cells, and those stem cells are designated. They call it differentiated, but to me, it's more relatable if I say it's designated. So when we're born with a certain amount of stem cells, and they're all designated. They already have their job, per se. They are going to be bone cells, they're going to be muscle cells, they're going to be heart cells, they're going to be skin cells, they're going to be hair cells. So as we get older, the harder we are on our bodies through diet and through our activity level and through the exposure of toxins and through going out in the sun, our ability to regenerate healthy skin, hair, heart, muscles are decreased immensely, especially when we get 80. If a baby falls from this level down, they may not even injure themselves, or it might injure themselves and it will heal, but an 80-year-old, a broken hip could be life-threatening, and that's why. So the critical key here is what causes degeneration of those cells. As we grow older, again, natural aging, disease, lifestyle, oxidative stress, genetics, epigenetics, those are all factors of how we're going to age. But what if we could not degenerate? The solution would be, let's operate on you. That's the medical solution. You break a bone, you have a torn ligament, you have a torn muscle, well, let's just operate on you. Let's just sew that back up. Or let's medicate you. Let's medicate you with medications that have bigger side effects than the treatments. And we always have this thing called risk versus benefit. So the risk of being treated with ibuprofen for the rest of your life is weak bones. The inability for your bones to be strong when you're older, and other complications and things like that. So what could be a better solution? And this is why the medical field started researching in how come the babies can regenerate so quickly, but when we're 80, we can't. And then they started pulling out and realized it was because of this magic cell. Now you can get stem cells 2 different ways. You can get autologous cells. These are cells from your own bone marrow or from your fat. If you get cells from your own bone marrow or from your fat, they spin them down, they draw out the stem cells, and then they can put them back into you. You can put them in joint injections, sometimes through the muscle, sometimes IV, depending on how you choose to have those given to you. The problem here is if you logically think about this, if you're 65 years old, we already know that your ability to regenerate is lower, but we just took cells from you, we're spinning them down, we're putting them in your joint, and then we're giving you your cells back. What if I put heart cells in my knee? Is it going to fix my knee? Probably not, because they're already designated, right? They're already differentiated. Now, it does help because if I put something in that knee space, it releases the pressure. It allows for some healing because now you're not walking on it, you're not running on it, you're allowing it to heal. But then that always wants to push anything weird, anything other than synovial fluid out. So it's going to push it out into the surrounding area. So how long does that last? How many of you have had injections in your knee every 3 months, every 6 months, every year, right? Because we're not really repairing it. We're band-aiding it, I guess you could say. The other way is allogenic. Allogenic is from day one, umbilical cord or placenta. So the companies that we get our cells from are United States based. They are labs that are monitored and have certain guidelines in order to be able to provide for the public. And these are cells that were donated by a mother who has not had vaccinations, has not had COVID, is followed all the way through her pregnancy. The baby is delivered via C-section. The cord is gently clamped because we all know that trauma comes at a cellular level. It's gently clamped, and then the cord or the placenta is then taken to the lab, and cells are taken out of the cord or the placenta. They separate the red blood cells and the white blood cells, and they keep all the good stuff, everything in there that baby provided day one. And these cells don't have a job. These cells don't know what they want to be. They're going to grow up to be whatever your body needs. How do they know? It's called cell signaling. When your body's injured, it sends out a signal that says, I need help, I need repair. Your body says, oh, that muscle or that knee or that foot needs repair, and it sends the cells to that foot, that muscle, whatever. And then the cells attach, release exosomes for repair, and then you're healing. So these cells, when we put them in your body, because they don't have a job, they're going to go wherever your body needs repair. Now, let's say you need repair in your left knee because you have a torn meniscus. That's great. We can put those cells right straight into the knee. But again, will it heal that knee? We don't know. The evidence shows that it will help. We're finding more evidence saying that if we put it through a shot in your shoulder or through IV, it actually helps better. So that's where the FDA comes in and says, wait just a minute, this isn't FDA approved. We can't treat it as a medicine because we're putting it in somebody's body. It's not technically a medicine. So there's this fine line of how can we be the practitioners using cutting-edge medical treatments and follow guidelines of the world to improve your life, right? So it's kind of a little sticky thing. So in Utah, we're allowed to talk about stem cells, and we're allowed to utilize umbilical stem cells for repair of people. But what we have to tell you is that it's not FDA approved. There is no guarantee that it's going to help. There's no guarantee it's going to cure or treat, and we can't claim that it's going to cure or treat. But we can tell you that there's studies that are all over, and if you look stem cells at Indeed.com, you will see every major university in the United States is hiring scientists to study this. But we cannot tell you where to find your research. So you have to trust or do some research on your own, which we always highly recommend, and we always highly recommend that you talk to your provider before going under or having any type of procedure. So we talked about exosomes. So stem cells are the way to regenerate. So what they do when they go to where it signals that muscle, and it attaches to that muscle, it becomes a muscle cell. It releases exosomes for the repair, but then the stem cell regenerates muscle. It regenerates more muscle cells because now it has the ability to regenerate itself as a muscle cell. So you're giving your body like a boost in whatever it is that you need repairing. But an exosome cannot replicate. An exosome is the DNA, the RNA, the lipids, the proteins, the things that cellularly communicate to heal itself. It's the repair agent, it's the power behind the stem cell. So if you hear somebody going to Mexico, heaven forbid, but they go to Mexico and they're getting 14 billion cells, chances are they're getting 14 billion exosomes that are already designated, already part of that. And if they're going down for a muscle tear and they're getting muscle exosomes, hallelujah, right? We're going to repair that, we're just not going to regenerate. So that is the difference between exosomes and stem cells and how they work. I'm clicking my clicker. Oh, there we go. So we can use exosomes though in different ways, and part of the ways that we use exosomes is to regenerate hair follicles. Crazy as it seems, if your male pattern baldness is happening, we can actually put exosomes, hair exosomes, into your skin by microneedling and have your hair grow back. It is so cool to see. And we also can improve skin elasticity, decreasing your wrinkles, boosting your collagen and your elastin, because that is what is needed in the skin exosomes for repair. And then we have additional treatments, erectile dysfunction, vaginal tissue repair, and those are all certain exosomes that are derived from stem cells. There's different ones too. You'll see like somebody having heart issues, that there are places that will put heart exosomes right into the heart. I don't do that. But there are places that do that. So the science and research behind stem cells is extensive. It's huge. If you look up scholarly articles on stem cell or stem cell treatments, you will see that it is being studied in all different kinds of things. So if you know somebody who has chronic joint pain, chronic back pain, has torn meniscus, torn muscles, spinal cord injuries, and clear down to autism, long COVID, Alzheimer's, it's huge. We are seeing great results with the studies. But again, I can't tell you where to find these studies. There is a government website that you can look at. One of the stories I have, and I am allowed to say, is I had a guy who was a special ops, and his job was to jump out of airplanes. He came to me and he said, I tore my muscle. He jumped out of an airplane, landed wrong, tore his muscle vertically, right here. This was on Friday. On Wednesday, he came in, he said, I have my MRI, tore the muscle vertically. The doctor told me I can't have surgery to repair it. He said, what I have to do is allow the scar tissue to heal over and it will eventually scar together. I have to wear a knee brace for 6 weeks and I can't jump out of an airplane for at least 2 months. He said, but if I do, I have the chance of injuring it again because scar tissue is weaker than muscle. He said, so I want to see if the stem cells will work. Of course, I don't know if they're going to work. I can't say they're going to treat it, but we did it. We did a stem cell infusion on him the following Friday. So he jumped out of an airplane on Friday, got an MRI on Wednesday, got the cells on Friday. The following Wednesday, I called him and I said, hey, I'm just checking in on you, seeing how it's going. He goes, oh, I'm on vacation. I was like, okay, well, what are you doing? Well, I'm hiking. I said, well, do you have your knee brace on? He goes, no, I got a little limp. It's okay, it's not a big deal. The following Friday, he got home from vacation and he said, I haven't had to wear a knee brace, totally fine, no pain, no limp. 2 weeks after the infusion, he jumped out of an airplane. So what I can say is for him, because his injury was so acute, it worked really, really well. But we're finding some patients that have Parkinson's or some patients who have brain injury or stroke that it takes longer for that repair, and sometimes the repair takes more experiences or more exposures to the stem cells. Because if you think about it, our body has already attempted to survive for so long with an injury that it's doing everything it can to work correctly, so it's going to take longer to repair that. But crazy cool. So where do you get stem cells? Well, you can go to South America, you can go to Mexico, you can go to Colombia, and we don't really know what we're getting. I was talking to a gal a couple weeks ago, letting her know that I now do this therapy at my clinic, and she said, well, my husband goes down every 2 months to Mexico and gets shark and sheep cells. Apparently, at the stem cell level, shark and sheep cells are pretty identical to human cells. But I don't know. I don't want sharks. I would hold a shark, but I don't want shark cells in my body. Like, I imagine, what is that show where the kid grows up and he has gills and he can swim underwater? Like, that's what we're gonna do to our generations of kids, is now we're gonna have gills and swim. I don't know. I'm just making that up. That's all fictional. That's not really true. And you can get them off the street. There's a guy in town, I'm not gonna say his name, charges $50,000. You go to the hotel and you get some cells. I hope they're good. Not a great idea. I don't think that you should do that. You should actually find somebody that has a lab that they're connected with, or talk to your medical provider about it. Again, I get mine from American labs that have rules and regulations for cell collection and distribution. I'm not sure if you can hear this. Can you hear this? He's on the bottom of the Mexican hat trying to get up. My husband's on top trying to force him not to get up.
Almost gone. I still get a few twinges here and there, but it is a lot better than it was. I was really skeptical, but it has surprised me. As of right now, there's no plans for surgery. If anything, I wouldn't mind another stem cells.
That's my friend Nate. Calls me and he says, what is this hocus pocus stuff you're doing? I said, well, Nate, it's stem cells. I mean, you can try it, it's up to you. He said, well, I've got a labor tear. He is a finished carpenter, so he's always hammering. He's always using that arm. And he said, I can't move my arm. And when I saw him, he could barely move like this far. And he said, I'm at work. I can't work. I can't do the surgery right now because I really can't afford it, but what do I do in the meantime? Is there therapy? Is there something I can do in the meantime? So I said, well, let's try this. Let's see if it works. So we gave him the infusion. It was about a month later, I called. I said, hey, Nate, how you doing? And he goes, your stuff doesn't work. I said, it doesn't? He said, no. I said, well, you haven't had surgery yet? And he said, no, I'm still thinking about it. I said, okay, well, let's give it 6 months, because we know 3 months in is when the repairs happen from time of the infusion to 3 months, and the following 3 months is regeneration. So let's give it 6 months. If it doesn't work, the least that will happen is you'll have healthy cells for repair after the surgery. So 6 months later, we're in Mexico, and we're playing in the water. I recorded that video. I came home. I'm driving to work, and it dawns on me, oh my gosh, he was using that arm, like for real. And I hurried and pulled up my computer, and I looked at that video, and I was just like, I tried getting up there on that thing. I couldn't. I wasted my energy. He was pulling with all his energy and all his might, and that was the very first floaty that we did when we first got there, and we were there all day long. Never once did he complain of pain, nothing. So I texted him, I'm like, Nate, you saw the video, right? Like, does your arm not hurt? And he goes, it's amazing, I love it, I tell everybody about it. So it's things like that. That's why we get into the medical world. And the amazing thing about being a nurse practitioner is forever, 20 years, I've been told preventative medicine changes. the world. Preventative medicine is what is the key. We are not supposed to be reactively treating, we are supposed to be preventively treating. And lo and behold, it took nurse practitioners coming up through the woodworks in COVID to allow us to preach now preventative medicine. The diseases that are out there today are curable if we act and we treat our bodies like the amazing vessels they are. Because we can regenerate, and we have the tools. We just have to love ourselves enough to provide ourselves those tools. So, that is stem cells. I appreciate you guys' time. I know it was an add-on, and I love it. Thank you very much. Yeah, thank you. Yeah.
My husband has degenerative back disease and arthritis. Do you find that it's helpful? He's had a herniated disc that they
Yeah.
do you find that this is helpful for those issues that suffers from disability back?
So I do know of 2 clients in the last year that I've infused. One of them I literally just spoke to yesterday. She has rheumatoid arthritis. She's doing another set of cells next week. I do know that the one who had major back pain was in a wheelchair. She couldn't walk. She was so much pain that she couldn't walk. We did the cells, and a month later she was so excited because she was walking through the temple. And I saw her, it's been 8 months, and she said it changed my life. She said it absolutely changed my life. So to answer your question, yes, there's evidence that it does help regenerate that. The key is, can we get in there fast enough, right? And how we apply it. So my theory is a lot of physicians would say, well, let's inject in the back. My theory is let's inject IV so that we can provide as many cells as we can to go to the back and regenerate. And then if we need to do PRP after, then we're pulling healthy cells out to do PRP and to relieve some of that pressure. Does that make sense? But yes, the lady with rheumatoid arthritis that's coming back, she was going to a doctor that was injecting every joint in her body. And it's been a year. And she said, I realize now I just probably need this every year. So it's crazy. I can't say it won't work. All I can say is see.
Any other questions?
So one thing before I leave, I want you to know, as an RN, I've been infusing for over a year. As a nurse practitioner, I've been infusing for over 3 months. Yay, congratulations. But in that year, I wasn't able to follow up with the patients that I saw. They came into my clinic, I did the infusion, and they walked out or wheeled out or whatever. I hear stories from the doctor that was over me. He would tell stories. But to me, they seemed so far-fetched. I was like, okay, really? That seems not right. You know, it just seemed weird. It just seemed too good to be true. But what I can tell you, honestly and assuredly, is I would do an infusion on somebody. 3 weeks later, their neighbor, their mom, their grandma, all 5 of their brothers would be in my clinic doing infusions on themselves. And they would tell me, I saw what it did for Aunt Josie, and if it can do that for her, it's gonna do miracles for me. I saw it do what it did, you know, with my Parkinson's dad, and if it can do that for me, I don't know what's wrong with me, but I'm getting it. And for people to come in like that, to me, it was more validating than hearing somebody's story, right? Because I saw it. I saw people coming in and putting money, and if you can imagine, this technique isn't cheap, right? We try to make it affordable, but it's not cheap. But people were coming in the droves, Every time, every single time I have done an infusion, I have seen a family member, a neighbor, or somebody that knows somebody that did it 3 weeks ago. So it's just, now I get to hear my stories. I get to hear my own stories.
So I'm just wondering, like, if somebody has type 1 diabetes and you got an infusion, could it help your pancreas reheal? Could it help your organs start rehealing?
Great question. There is evidence that it can, yes. And the thing that would be to do a stem cell infusion. Watch, you make sure we're doing pre-testing and then mid-testing and then post-testing to see where we are really in that process. But then you can also do some pancreatic exosomes after for repair too. But there are studies that show that it does help with type 1 diabetes, yes. Anybody else?
What if, like, the age limit, like, how old someone has to be to do this?
Right, good question. According to the doctor that introduced me to it, he says there's no age limit. Anybody can do it. The cells can go fairly easy, but the more we notice is our cells start to decline and drop at the age of 40. That's like a critical moment. So in the research world, we're saying, when is the best time for somebody to come in and start getting therapy? And right now, the best time is pointing towards 40 years old. Right? I mean, I was in my prime of my life when I was 30. I was like, I never want to be, I'm going to be 30 forever. But that's what they say is a 40. But I've infused 13-year-olds, just did a 24-year-old, just depending on what the issue is and the condition. The younger ones are usually acute injuries, and they're trying to avoid surgery. Anybody else? Here is what we say, 5 to 7 days of no heavy lifting or exercise or sports, because we don't want you to re-injure or injure something else. We want those cells to go where you want those cells to go. And no alcohol for 72 hours, and that's about it. No anti-inflammatories. We want the inflammatory response that the cells cause, because that's how those cell signals happen. So no anti-inflammatories for 5 to 7 days too. Other than that, not really. If you're gonna do just a procedure, you would come into my clinic, we'd do the IV, we'd do the cells, and you'd go out, and it would be a 20-minute procedure. Unfortunately, if you come to my clinic, it's an hour long, because I like to hear your story, and as we're thawing them out, anybody that's in the room, I pray over the cells, and I ask everybody in the room to pray over the cells too. Because I think that this is a really special moment that some lady said, my baby is going to give life to somebody else. And we want those cells to be happy in the environment that they're going to. And I always just ask them to go where they need to go. And then we all pray over them. So mine's a little bit different, I guess you could say. I don't know how many providers actually, well, I'm sure almost every provider prays, but you don't know it. But I try to make it a little more sacred, because it is a sacred process to me. Any other questions? All right, look, I'm done early. You guys get a bigger break.